Uh-oh.
Okay, let's get started. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you for joining us for this week's cross-industry update session with Boulder County Public Health. We did take last week off, and we hope everybody had a relaxing, probably somewhat boring Thanksgiving, but hopefully that keeps our virus levels down as a community. We will be going through, again, the epidemiological numbers, order updates, answering questions. There have been a lot of questions that have come in over these past 2 weeks. And so I know Jesse's going to cover some of the common questions, but do not hesitate to put your questions in the Q&A. Again, put them in the Q&A and not the chat. We use the chat to share information. I will ask them on your behalf. We don't really put people into the live talking because we do have a lot of people on these webinars. At this point, I'm going to hand it over to Jesse. Go ahead and get started on your update.
All right. Thanks, Corinne, and welcome everybody. I'll jump right in here. We'll do a short epidemiological update, get into the dial status, and then go over both the public health orders and sick employee and quarantine, sick employee and outbreak rules, and then we'll jump to your questions. So in the past, I've done a lot of different charts. I think the chart I want to hit on today is this one. This is our 5-day average, rolling average of new cases. We're down at 157 from our peak, which is great. Unfortunately, it's likely that this trough is more associated with testing and the number of people getting tested as opposed to really a huge decline. We are seeing stabilization in numbers, but then again, with the holiday, that may change. So just want to, there is good news, but it's tempered by the fact that when there's an event like Thanksgiving or any holiday, we do see a lagging increase in cases. So our big takeaways for epidemiology right now is that case numbers remain high. Interestingly, we're seeing age groups diverging. So whereas before, for the last couple of weeks, basically all the age groups have been increasing at the same rate, we're now seeing that diverging. It's a small difference now, but definitely next week I'll bring that chart along, and I want to show that if it's a continuing trend, and we can discuss what that means. In terms of hospitalizations, they are continuing to go up statewide, and I'll get into a little bit of that later. Testing is stable, so I mentioned that there's less testing over the holiday, but in general, our testing numbers are remaining stable day to day, whereas positivity is still rising. It's lower than it's been in the past, though. So I will, or in the recent past, I guess I should say. So let's jump to the dial now. So we are still at level red of the dial, and across the state, we're seeing a lot of the vast majority of counties are in red in terms of our cumulative incidence, and we're at 759, which is actually slightly lower than we were last week. So that again reflects that drop over Thanksgiving. But in terms of where we are compared to other state counties around us, we are actually pretty good compared to other counties around us. So that's a bit of good news. In terms of our 2-week testing positivity rate, we are a little bit better than we were last week. We were, 2 weeks ago, we were at 8%, I believe, and now we're down to 6.7% 2-week testing positivity rate, which is good news. And then in terms of our hospitalization status, we're actually we're in a good place too. There were, I believe, on Monday we were actually at 7 days, and now we're 8. So we're getting better. So that's also good. About hospitalizations, I mentioned before that we would talk about a little bit. We are still seeing that increasing hospitalization rate, and that is not a good sign. And that's our hospital facilities are currently able to handle the the number of cases that are coming in. We're not seeing a shortage of ICU beds or PPE. However, we are seeing staff shortages, and that's an indicator that there are more people who are being impacted by this. And seen various numbers floating around. The one number I last saw that I trusted was that 1 in 41 Coloradans are infected at this point, and so that means that every business is seeing shortages of staff availability as more and more people are getting sick. So just really need to be aware of that. And one of the things that I wanted to jump to now, on the dial, level purple is the new what used to be level red. It's the stay-at-home level, essentially. And one of the ways they're looking at that is whether we go into hospital surge across the state or in a particular county. And I think the good news here is Boulder County is not close to that level. We're seeing, again, what I said, we're not at crisis levels for availability, but we are seeing those staffing issues. So that's really where our concern is right now. This is something new that I will keep track of and include in this report each week, just so that we're aware of where we are compared to other counties and also compared to the whole state. So with that, I'll switch gears and talk about sectors in the new public health order. So I'm just going to go through this pretty quickly. We've talked about it the last couple of weeks. So again, public and private gatherings of 2 or more households are prohibited. That is still in effect. Non-critical office-based businesses can operate at 10% of posted occupancy. We've been talking to the state about this, and they say it's very easy for every business to find their occupancy numbers. We have not found that to be true in conversations with businesses. So if you are having trouble finding your occupancy, my recommendation is to reach out to your fire department, or if you're in the unincorporated county, reaching out to your fire district. They may have records that indicate what your posted occupancy per room is within your building. And critical and non-critical retail is at 50%. That is, that's again, the posted occupancy for the space, and that does include staff, your employees. And the state is, again, encouraging enhanced curbside and any other ways to have some of your demand diverge, get away from that, the in-store sales. Non-critical manufacturing is at 25% or 50 people. Field services are closed. Individual real estate showings may continue. So that's a very interesting thing. And I would also point out that field services that are necessary to operate a business, so things like trash removal, any sort of landscaping that needs to happen, snow removal, that sort of stuff is all allowed to continue under this closure. We're more looking at the field services that have a lot of people gathering together that are the problem. And so things like open houses are not allowed. There's a bit of confusion there. Open houses are allowed as long as only one person is only one person is being shown, or one family is being shown at a time. So you may quibble with my language there, but you can't have just everyone showing up all at once and walking through a house for sale. What you need to do is have sign up so that one family or one individual can be shown the house at a time. A little bit of confusion there. In terms of personal service and limited healthcare, they are the same as level orange, and that includes their occupancy, which is at 25%, as well as all of their practices, which everybody needs to be wearing a mask, limiting the number of people who are waiting in a waiting room, that sort of thing. Indoor events are closed. There are no indoor events, and that includes Unfortunately, at this time, museums are still considered an indoor event by the state. Outdoor events may operate at 25% of the occupancy, not to exceed 75 people. And during those outdoor events, everyone needs to be distanced outside of their household. And if you, so that's that. And in the county, it's recommended that you be wearing a mask. The state's also recommending wearing a mask, but remember that if you don't think you can maintain 6 feet outdoors, you need to be wearing a mask. And while at an outdoor event, it says maintain 6 feet, but almost certainly you're going to be closer. So we really recommend people be wearing masks at those outdoor events. Restaurants, indoor restaurants spaces must be closed. You can offer takeout and delivery. Obviously, the indoor space can be open for pickup of food, for paying the bill, going to the bathroom, that sort of thing. But in terms of where people can sit to eat, the only spaces that are permitted are outdoors, and they must be licensed to operate with your municipality or with the county if you're in the unincorporated county. And tables need to be spaced such that you can maintain 6 feet between parties, and only one family at each table. Alcohol sales must cease at 8 p.m. for on-premises consumption. Takeout of alcohol may continue until 10 p.m. That does not impact your ability to continue to sell food. It's just alcohol related. For houses of worship and life rights, for indoor services, you can have up to 25% of capacity of your space, as long as that's no more than 50 people. Outdoors, there's no capacity limit. We would really like it if you could contact us and we can work on understanding the space that you're using and give some recommendations in terms of capacity. But you must maintain 6 feet of social distancing between families, and again, encourage you to wear masks in those cases. Recreation, gyms must operate at 10%, not to exceed 10% people per room, and that does not include staff in those rooms. Reservations are required for all indoor and outdoor services. No organized sports indoors. Organized sports may occur outside. However, they need to be 10 people maximum, social distancing, everyone wearing a mask. So if you can't play your sport while maintaining 6 feet of distance, you can't play indoor or outdoor. Outdoor guided activities, 25% of capacity not to exceed 10 people. Children's camps, no more than 10 participant outdoors only. Finally, I've been harping on this the last couple of weeks and I'm going to continue doing it. Critical businesses, you must follow the sector guidance above. So follow the sector guidance for your sector in terms of capacity, in terms of masking, in terms of cleaning, unless doing so would make it impossible. And that's a pretty serious word there. That's carrying a lot of weight there. Impossible to carry out your critical functions. And then finally, employees in a critical operation must follow all guidance as well. That includes quarantine periods and all of that. So just want to harp on those things. So jumping to sick employees and outbreaks, if you have a single sick employee, you do not need to shut down. Send that sick employee home, and that is a requirement. You are not allowed to have a sick employee come to work. If you find out that they are sick, if they tested positive, or if they have any of the symptoms listed, you are required by the state to send them home. You then need to inform the rest of the staff of a possible exposure without telling people who it was. That's the hard part. And then identifying close contacts. And I'll go over what a close contact is in a moment. You need to clean workspaces for any of those employees that have been sent home. You need to wait 24 hours and then clean that workspace. That's to protect them in the future, as well as any other employees who may come into contact with that workspace. So what is a close contact? It's anyone who was within 6 feet of a person who tested positive for more than 15 minutes in a workday. So in other words, if you have an employee who calls you, says, I tested positive, it's on your team. We will try to help as best we can to work through this with you, but it is on your team to figure out anybody who was within 6 feet of that person, with or without a mask, does not matter, for 15 minutes throughout a workday. And it's important to note that when they get tested, you need to think for all of the time 2 days before that positive test. So if they got tested on a Wednesday, you need to be looking back to who did they interact with all the way back to Monday, through when they let you know that they tested positive. And then this is a detail that I think Lane does a good job of explaining, but a contact of a contact is not a close contact. So in other words, if I am, if my partner is positive for COVID-19 and I've gone to work, but then I call you as the boss and say, hey, I can't come to work, I need to quarantine. People who were close to me before I quarantined, they're not considered a close contact. They'd have to be in close contact with the person who tested positive directly. There's not a second order contact there. So with that, I'll move to the difference between quarantine and isolation. Isolation is for people who have a positive test, and you isolate for 10 days plus the time it takes to have no symptoms. So if you get gone for 10 days and you still have a fever, you need to stay out of work until that fever is gone. And during isolation, people in isolation should have no contact with others. They need to be ordering in food, whatever needs to happen, so that you're not in contact with other people. Close contacts must quarantine, and people who have symptoms but haven't tested positive must also quarantine. And right now in the state, quarantine is 14 days. I know that the CDC just updated their recommendations. The state has not changed their recommendations, and we're following the state's recommendations. So right now, 14 days quarantine, no way out of it, for close contacts and people who have symptoms but have not yet tested positive. Those who are in quarantine, you can shop for essentials. There are limited ways to get out, but you really should be limiting contact with everyone. For outbreaks, an outbreak is if 2 or more employees test positive in a 2-week period, but that's only you may have an outbreak situation. If that happens, if you find out that you've had 2 people or a second person tests positive, you need to close the business for the day and contact Boulder County Public Health. We will work through this with you. There are a lot of situations where the 2 employees don't have, they didn't share the virus, or they got it from different sources, whatever may be. It's possible that it's not an outbreak, and you'll be able to reopen within a day. Or if we're able to isolate the group that did have contact with those 2 employees, and they worked a shift at one time, so you can get all those people into quarantine, then you can reopen. So we will work with you to try and figure out both, is it an outbreak, and second, how quickly can you reopen, and what do you need to do to reopen safely? With that, I think just want to remind everyone, exposure notification system. I keep forgetting to change this link, Corinne, sorry. I think it's www.add my phone or add your phone, and really good. There are now, I think, 15% of the population has signed up for this in Colorado, and we want to get that number higher. It uses Bluetooth to identify when you're close to someone else who may have tested positive. However, it does not keep any of your location data, and it actually does not know where you are. It just says, here's someone who tested positive, their Bluetooth signal, your Bluetooth signal was within that area at some point during their positive period. So it's a really useful tool for getting that information out. And with that, I think the big news is next week. And Corinne, make sure that these days and times are right. Now I'm looking at it, I'm suddenly nervous about this. Next week, starting next week, Jeff Zayak, the public health director, will be holding a public information session from 3:30 to 4:30 on Wednesdays. I totally encourage you to go to that. It's more for the general public, getting news out, getting information out, answering any questions that might have come in. So really encourage you to get to that, but that means we are changing our session so that we can maximize time with all of you. We'll be on Thursdays at 1 p.m. for this general update discussion, and then Fridays at 11 a.m. to be decided. And this week, and this is the part that I'm not sure about, Corinne, Friday at 1, we're going to do another 11. Okay, so this Friday at 11, perfect. We are going to do a session for landlords of businesses that have buildings that have multiple businesses or office-based businesses, just so we can try and help you understand what the restrictions are on your specific building. As of right now, the Spanish language session has not changed in time. Those are released on Thursdays, and that's in collaboration with the Latino Chamber. So a lot of changes, a lot of moving parts right now, but definitely join us if you are a landlord or interested in hearing how the landlords are faring with this. Friday at 11, this coming Friday. And then next week, we're starting the new schedule Thursdays for this general update session. And this will all be in the emails that Corinne sends out, and much clearer than I could ever explain it. So.
And I'll include the link to be able to listen to Jeff Zayak. Awesome. It used to be a session that he did with City of Boulder, but now they're going to start doing it county-wide. The county's taking it over. So it used to be on Mondays, and now it's moving to Wednesdays. So we will include the link to that or information on that so people can get information on when they can learn more about the public session. So those deal with a lot more about like the education, some of those things that aren't covered. It doesn't go into detail on the orders and the specific business type stuff that we cover in these sessions.
Awesome. Okay, and then just to close out here, happy to take questions after this, but just wanted to remind you all, if you have questions or concerns, email us at covidbiz@bouldercounty.org, and the call center is still open 9 to 2 Monday to Friday at the number below in case you have complaints. And that's it for me.
Okay, well, you already guessed a couple of the questions that would come in. So can you explain a little bit about the CDC's change in their quarantine guidance and whether or not that might change within the state of Colorado and why it may not have changed already within CDPHE?
Absolutely. So, the CDC is constantly looking at the research regarding the incubation times for the virus. And this has been probably a long time coming, but as you know, I think it's fair to say that public health agencies are trying to be pretty conservative about this. So when it looks like there's an opportunity to reduce quarantine to 10 days and 7 days if you get a test, but all those details are still being worked out. CDC has changed their recommendation, and it's likely that the state will change theirs, but we don't know anything about when that would happen. I think the important thing to know is Corinne and Lane and I were talking about this earlier. As soon as we know, Corinne will send an email out, and then we'll talk about it in our Thursday meetings now. So I think it's really important to know that as soon as we can tell you that it's changing, we will outline how it's changing and get that news out to you.
And the key there is, I think one of the questions came in as the isolation time is changing. The key there is that there's a difference between isolation and quarantine. Isolation means you have the virus you must isolate into 10 days plus the time period of your symptoms going away. Quarantine is you've been exposed to the virus. And so they're looking at the time frame as to how long you must stay in quarantine after exposure to the virus. So once the state changes theirs, which is what all the public health departments are following, we will send out that information. Even then, the quarantine period will still be an extended period. So if you've been exposed, even on day one, you get a negative test, you're still going to need to quarantine for a specific amount of time, correct?
Yes, and thank you for making the point about isolation. And I do not believe there was any change in the guidance for isolation. That's still that 10 days plus the time it takes you to have no symptoms. Obviously, again, that's something that they're looking at. So that may change as well, and we will update you if it does.
And just to get into a little more detail, so the isolation, it's specifically fever. So because some people may have a lingering cough or some other less descriptive or less concerning of the symptoms that might linger, but that fever that shows that you're potentially still contagious has to be resolved for at least 24 hours without the use of any medication.
Thanks, Lane.
Somebody did point out that that it does take several days to get your test results. So you might end up quarantining for 10 days, even if it's 7 days, if you're not getting your test till day 7. So I think there's a lot to be worked out in that. So I think there's some time, but like Jesse said, as soon as the state changes their recommendations and works through some of these details, we will push out the information to businesses and how this affects you. Now, I have gotten the question, oh my gosh, one of my employees, it got was exposed to a positive case. I need them to get a rapid test so they can come back to work. They're in quarantine, correct?
Nope. Yes. Yep.
Doesn't matter right now if it's 10 or 14 days, they're not coming back to work today, right?
Nope.
Now, the challenge with all of it is the time it takes from when you are exposed to the virus to when you potentially can become ill. So you can't get tested with any test that would predict you could become sick still. So the tests are all going to test either that you've had the virus in the past, so that you still have some of that DNA, or that you're actively ill right now. But there's no test that's predictive to tell you the virus could be in your body and you eventually will become sick. So that's the hard part. And that's why with that incubation period, and the change now from the CDC is really based on, there's really so few, if any, cases that really are developing at the 14-day period. So it's an overly conservative time frame that's really burdensome on people to quarantine for 14 days. So hopefully the state will follow and reduce that time frame.
And Lane, just as you pointed out, that 10-day isolation. So you have the virus, the 10-day isolation plus the removal of not having your symptoms. That's that fever, some of those other symptoms. We've heard that some people lose their sense of taste and smell for longer periods. So that's why that particular symptom is not included in that. We actually have a question about this one. Yeah. So it's particularly the fever, sometimes the cough, some of those others.
It's very specific actually to the fever, because again, some of those other things, as people who've been sick in the past with respiratory diseases, sometimes a cough can linger for a really long time, but you're not contagious.
Okay. So, all right. So on the outbreak side, so we'd say 2 or more cases in 14 days is considered an outbreak, and then you work with businesses to decide whether or not it's an outbreak. That's employees, correct? Not necessarily patrons, right?
Yeah.
Okay. So what happens if you're a retailer or a restaurant and you get your second positive case on the weekend? Who do you call at Boulder County Public Health? Do you close and call this now? Because this is the call center. Is that open on the weekend?
It is not open on the weekends. If you get your second positive test on the weekend, I'm not sure. I would think check our website, and I bet you there is a direct line to the epidemiological team. But Lane, I don't know if you know an answer to that.
I'm going to post. So really the best thing for you to do is follow the outbreak guidance. That's what we would be telling you to do anyway in order to get you reopened. So I'm going to post that link.
So you fill out the form, you submit it to CDPHE, and then you do the step that I send out every week. But the first step is you with that second test, you still need to close, even if it's on the weekend, you're a retailer or a restaurant, you're going to need to close your shop, correct?
Yep. Yes.
And really the step for closing is so you can identify, Jesse kind of covered all this, who are the high risk exposures that you need to make sure don't come back to work to further spread disease. You clean the areas that were potentially impacted where the sick employee was working. And again, have that chance to really gather that information. So that's why you take a break from your normal actions or your business so that you can make sure you're not further spreading the disease. Once you've addressed all those issues, now you can reopen. So that's why if you follow this guidance, you can speed that up. So if you've done all these things, that would constitute your closure and reopening, even if we aren't able to walk you through all the steps ourselves. So if you can follow these on your own, you could close, address all those issues, and then reopen over the weekend potentially.
So the more information you have, when employees were working together, how close in contact they were, all of that tracing piece will help you reopen quicker. We have some questions. I think a lot of businesses are waiting for you to do the contact tracing for them, but in a lot of cases, they need to do a lot of that work. They need to figure out who was within 6 feet for more than 15 minutes of the people that tested positive, who might need to quarantine, do a lot of that work. There is a question about that 15 minutes. Is it 15 minutes throughout the day or just 15 minutes in a row?
It's 15 minutes throughout the day. It's technically over a 24-hour period.
Mask or no mask?
Doesn't matter. Yeah.
And that's a conservative decision because not all masks are created equal. Not all people are as good at making sure that they're covering their face, nose, mouth appropriately. So to say that you had a mask on, some cases, maybe that would be appropriate, but other cases it probably isn't. So that's a conservative decision. There's probably some situations like healthcare settings, obviously, where they're wearing N95 respirators. Those are not necessarily considered people that have to quarantine because they're dealing with COVID patients, kind of all day long. So there could be a few mitigating circumstances, but all in all, just the common masks are not going to constitute your prevention of quarantine.
Okay. All right, so let's talk a little bit about the symptom check form that people have to, your employee symptom checks. If someone says they're feeling tired or fatigued, do you tell them they can't come to work that day?
No, it's sort of an interesting question because I think that for a while there was, and I haven't seen it in a while, but there was sort of this two-tier. These are the serious symptoms. These are the less serious symptoms. And I think to a large extent they went away from that because of the way people were maybe gaming the system. But I think the important thing to think about is, are these symptoms largely unusual? Like if you're someone who's prone to headaches and you have a headache, that's not an indication. But if you're not prone to headaches and all of a sudden you've had a 2-day long headache, that may be an indication that something is wrong. So it takes a little bit of self-analysis on the employee's part, which definitely makes it more complicated, I admit.
So some of the major symptoms: the fever, chills, rigor, new loss of taste or smell, new cough, shortness of breath or difficulty breathing. Those are you have one of those.
Yep.
You're not coming to work.
Yep.
But maybe if you have 2 of the sore throat, a runny nose, that muscle ache, fatigue, maybe if you have a fatigue and a headache, or nausea and fatigue, or a sore throat and fatigue, maybe that's that barrier. And I've sent this out, that the symptom screening and those different levels of the different symptoms that we've classified them as in the past.
Yeah, I think that it's also important to note, and I think we've talked about it in the past. If you're not feeling well, don't go to work anyway, because you could give the flu or something else, some other virus to your coworkers. So it's always a good idea to do, use these symptom checks as a way to take care of your own health, or your employees' health. But yeah, in terms of an indication that you may have coronavirus, you need to quarantine. I think, yeah, you're exactly right. Like the major ones definitely don't. With the other ones, it's more of a, you have to figure it out.
I think someone pointed out that, we're how many months into this, we're all feeling a little fatigued these days. So
Yeah.
I think Jesse's point really is this something that has a clear source? You had significant, strong workouts and now your body is feeling sore. Do you have a kind of a known reason why you're having this symptom versus these just came out of the blue and you really can't explain why you suddenly have a sore throat and your body is aching? That sounds like you probably caught something.
This is a good question, and I've heard it a couple times via email and on phone calls. How are businesses supposed to do contact tracing without divulging the person who tested positive? Are we supposed to rely solely on information from the sick employee, and probably records too? So if you could give a little bit more information on that.
Yeah, I think that is actually a very complicated thing. And that's why we recommend that you do keep the the symptom check records, because then you know who came into the office around the same time as the sick person. You'll also know, do these people work on a team? Well, then that's where you want to focus. And yeah, in those cases, it's going to be pretty easy to figure out who's sick when you go to a team of 5 people and one of the people's not there, and you say, hey, was anybody in close contact with Jim? Yeah, that may give it away. But that's, you just can't talk about the person who is sick, or, who needs to quarantine or isolate. You need to just look at, okay, who was around them during the day, looking at patterns of how people operate throughout the day.
In some businesses, that's why early on they were talking about cohorting, keeping shifts together, keeping people in groups, the same groups, so you can do a little bit easier time. It didn't matter what type of business, making sure the same people came in together. And then relying on the sick employee. I've heard, I talked to them and said, hey, who were you in the break room around? Or when people still had their break rooms open. A lot of people have closed theirs. And I have a question about that coming up.
Yeah, and I think you can just ask general questions. You can just say, based on the shifts, that's an important piece. Hopefully employers know who worked on what shifts. And you can just ask them, were you in close contact, meaning within 6 feet of any of your coworkers? And if so, who? And, so you can just ask those kind of questions rather than asking about an individual person. The best thing would be to ask the sick person who they were around, because then you don't have to ask all the other employees. And if they tell you the 3 people that they were around, now these are the people that need to now quarantine. So.
All right, so I had a lot of questions about JESAC session next Wednesday, and I don't have the actual information on it yet. So I don't think they have the information on the session yet. Well, like I said, as soon as
I guess what's the question?
How they can get access to the session.
So if you go on our website, I'm pretty sure that
it's up now.
The link is up now, but
okay.
Yeah, so, I'm not sure.
We'll send out the link, but it's on the Boulder County Public Health website. So like I said, it used to be managed through the city of Boulder, but it's now moved to Boulder County. So if you're asking the city of Boulder for it now, they're not going to have it. That's one of the questions that came in. It's now moved back to the Boulder County. And like I said, I'll send that out as soon as we have it. And if one of you come up with it, we'll put it in the chat. All right, let's move on to for contact tracing. And let's say you're a location that's maybe a gym or limited healthcare or personal services or some of those. For contact tracing, if an employee tells us they have tested positive, do we contact the patrons, maybe students, if you're a teacher, like a dance teacher, they came in contact with those employees, or just other employees?
I think, I mean, really you're looking at that, did they get within 6 feet for 15 minutes? So if you're a gym or a limited healthcare place, I think it really is important. Say you are an acupuncturist and one of your acupuncturists tests positive, contacting the clients who were with that person, that would actually be a very good idea. They were probably in that space with that person for more than 15 minutes. You don't have to say, X person tested positive. You could just contact them and say, you had an appointment on this day. One of our practitioners has tested positive. You're going to need to quarantine. That is a useful first step, I think.
But most likely, if it's like a dance class or those types of things, you're hopefully keeping that 6 feet of distance for more than 15 minutes. In that case, looking at your practices and maintaining that distance. But maybe in the personal services and those, you're probably going to need to do that contacting and create that quarantine.
And I do just one more thing about that. For gyms in particular, remember that indoors, yes, you can have up to 10 people, but they should remain physically distanced and wearing masks. Not that the mask thing makes a difference, but if they're further than 6 feet apart for their 45-minute class, then they are not close contacts.
And I did share the community update details in the chat. So the website has all the information. I also just put the link to the Zoom meeting.
Perfect. Thank you so much, Lane.
Yeah, thank you, Lane.
So really some of our, the question was, from a, more of a dance academy, but we can look at this as cross industry. You have a retail patron that calls you and says, hi, I was in your store, shopping the other day and I tested positive. What do you have to do anything with that?
No, so it would be very hard in a retail setting. And this actually, I noticed in the Q&A section, there's a question about retail capacities. And this is a perfect way to address both these questions. In retail, the modeling shows most people are interacting for way less than 15 minutes. And they're generally staying physically distanced. So the chances of any prolonged contact or the chance of any prolonged contact is pretty minimal. And that's why retail has been actually bumped up in terms of their capacity. Just recognizing the fact that retail it's not unusual, but it's different than a lot of our other industries where people are around each other for longer periods of time.
Because you're not staying stationary for 15 minutes, within 6 feet. Especially if the retailer is following the necessary practices within the order. The question that came in was specifically, why did retail bump up the capacity? And Jesse, we've done so many of these that you kind of guessed which question I was going to ask you next. That's kind of funny. So you're apparently either their audio or your audio cut off when you were talking about contact tracing. How many days back does an employer need to go from a positive test to contact trace within the organization?
2 days. 2 days. So looking back, if they tested positive on a Wednesday, and that's not, well, this may seem obvious, but if they went and got their test on Wednesday and then they didn't work for a while and they got their test results later, you're looking back from that Wednesday. Now, if they tested on a Wednesday, continued to work, and then got a positive result, you're looking at 2 days before the test plus all the days that they worked, obviously, since the test. But it's those 2 days before.
But if they were symptomatic when they went in for the test, they shouldn't have come into work anyways.
Yes, exactly. Yep. Absolutely.
Speaking of testing, someone said they've heard of, some limited healthcare practices that are having employees get tested on a rolling basis. Is there any reason to do this? Or are we even doing contact tracing fast enough that we can remove people in a timely manner?
So contact tracing is happening pretty fast. Now, I will say that with the number of cases we're having, nowhere in the state and at the state level are we able to keep up with the number of positive tests. So we are doing across the state as best we can to get in touch with people and trace and track and trace and all of that. However, and that's why, because we're overwhelmed at the moment, that's why we're saying it really is the responsibility of the businesses and the individuals to know the rules and take care of their fellow employees and fellow residents. But the question about regular testing, I would say that the limiting factor there is when you get your test back. So if you test on a rolling basis, even if you tested Monday, Tuesday, Wednesday, Thursday, if you're not getting the test results until the next Monday, is it really telling you anything? It's the test is not a good tool at this stage. Testing is not a good tool for that. I know that there was at one point discussion, and I think that there are some industries that have been able to use rapid testing, but they're rapid testing every day, and that's enabling them to do that. I don't know of anybody who has those resources in Boulder County to be able to rapid test every day to really ensure safety.
So I've gotten questions about the rapid testing, and there's capacity issues. You would have to do it a lot. You have to test pretty regularly, daily, and in order to be able to make those reliable. So there's capacity, there's funding issues around rapid testing at this time. Okay, so how long are we going to be at the current stage, Red?
That is, we don't know. And all I can say is that there is a protocol for within the dial framework for us to move out of it. If we reach and then maintain orange level or even yellow level indications, then we would move to that level after 2 weeks, and it would have to be staying at that level and showing trends that we're going to stay at that level after 2 weeks. So that's the protocol, that's the process that the state has set up. I'll just say that, and I didn't include the slide this time, but I believe the number for orange is 350 cases per 100,000. We are double that and more right now. And so we would have to reverse the trend and stay low for a long time. That's not impossible.
We're worried about our Thanksgiving, right. The post-Thanksgiving bump. Because
exactly.
As you saw, those bumps were normally 2 weeks after Labor Day, Memorial Day, Halloween, Thanksgiving,
and then Christmas. So yeah, we're in a particularly rough spot, and I wish I had shared, and I wish I had it open in front of me. One of the things, actually, I am going to go back to this because I think
there's a question There's a question while you're doing this. Your slide says we're at 759.9 per 100,000 for Boulder, but the Boulder County Public Health site says a lower number. And I want to point out that the state site is updated daily. The Boulder County Public Health site is updated not as often. So Jesse's slide is actually more accurate because you pulled that from the state site today or yesterday.
It was from yesterday. So actually today's, I went and checked because I saw that question and thought, oh, this is going to be something that I really want to know the answer to. We are actually right now, or as of whenever they updated, which was probably this morning, we're at 757 point something cases per 100,000. Yeah. So we're a tiny amount better, but again, we are up above where we were. And I wanted to highlight on this chart, I think it's important to note that back in September, we had that spike associated with CU. I almost said CSU. Some people would be very upset at me. But if you look at that, we were just over 150 cases on a 5-day rolling average, and it was for like 2 days. So now we are above that, and we've been above it for quite some time. So it's going to take a lot of time for us to reverse that trend. So I just wanted to illustrate that there. It's not exactly apples to oranges because this is not per 100,000 and it's not that 2-week incidence, but it's a good way to think about like, what is the difference in scale of time and the size of the outbreak? So just that
Well,
was
and we asked you to bring this chart in because it showed over time and you're able to show, just showing that one number didn't show us over time, and
right.
we're able to show those bumps and show relative over time where we are. But knowing that we're at 750, which is double the number allowed for orange,
Right.
and that we're, today our numbers will probably be above the 157. Sorry, where we need to make sure as a community we bring our numbers down.
Mm-hmm.
So that leads to this question of what's the realistic chance of us moving to purple?
Again, so purple is an interesting one, and I mentioned it on one of my slides. That's not associated with these metrics. That's associated with a point where our hospitals become overwhelmed by hospitalizations. But our facilities have to go into sort of emergency crisis mode, and there are statewide plans for that. However, we're not there, and all indications right now for Boulder show that we're not actually close to that either. So it's something that we are watching, and I'm going to include that slide because our statistics team is amazing, and they have started providing that data for us in our weekly updates. So I'm going to provide that for you weekly. It's a bit of, it comes out on Tuesday, so it'll be 2 days old by the time you get it, but it's a good indication of if we're even heading in that direction. And right now we are not there, and we're not heading in that direction at all. It's just, we're seeing hospitalizations increase, but right now our hospitals are capable of handling it because we have amazing healthcare professionals who are doing good work.
And I've heard Polis say that, unless our hospitals are overloaded, the point is not to completely shut down.
Yep. And sorry, go ahead.
Oh, and that's why they created this additional rainbow level on the dial, which became a little confusing. And then we ended up going to that next level. But all right, we have some youth questions and some capacity questions. So we'll start with the office capacity question. So let's say you have a building that has a capacity of 300, but there's office and retail. How do you divide that up? Is it you go by the retail, or do you go by the office, or do you have to divide each space based on what the purpose is?
Yep, divide the space based on the purpose. So if you have a room of offices or a part of the building that's offices, that part of the building would be under office guidance, and the retail space would be under retail guidance.
Okay. Now, our offices are limited to 10%, but there's no rule against taking in-person necessary client meetings at this time, correct?
Yes, absolutely. You can have clients. You do need to consider those clients in your capacity, but that's something to either work out with your coworkers or with your landlord to say, like, I need to continue to have in-office clients. Can we work out what that means for capacity for the other offices in the space?
So, and you want to try to stay distance. You want to wear a mask. You want to make sure you're doing all that, but that doesn't fall under the personal convening rule, though. It doesn't matter that you're from different households. You can have a necessary in-person client meeting. Now, they recommend you do it virtual if you can, but if you need to have a client meeting, it falls within your capacity limits. You're following all the rules. You can still do that.
Yeah, absolutely. And I think it's important to note that the way that the order is written, you sort of fall into the most appropriate category. And so things that are covered by the no personal gatherings are things that aren't covered somewhere else. So, even I was on a call earlier today with an ice rink it's an outdoor ice rink. Under the orders, if you get together if you call your friends and say, let's go ice skating, that's technically an outdoor event, not a gathering. Now, obviously, the ice rink has to follow a bunch of rules. You have to wear a mask, you have to be socially distanced. There are rules about how to arrive and how long you can be off the ice and on the ice. All of those sorts of things are the responsibility of the ice rink, but you can have what would seem like a gathering, but it's under outdoor event guidance. So I don't know if that helps explain, like, we try to put you in the most appropriate category as opposed to just trying to find ways to stop you from doing what you want.
So the personal gathering, your hairstylist, you can go get your hair done because that's not covered by the personal gathering. That's covered by personal services.
Yep.
An office can have 2 employees in it. That's not covered by personal gathering. That's covered by the office, the offerings guidance.
Yep.
Speaking of youth, are there youth activities that are currently permitted or not considered camps or organized sports? For example, can a school day off program be run by a group, or would that be considered a camp?
So there are some interesting category. I would say, first of all, that a school day off thing would be a camp, unfortunately, unless it was education, unless you were doing learning during that period. So there are, and this is outside of our area of work, but there are regulations having to do with educational pods that have allowed some businesses to offer educational services. The complication there is while your patrons are there learning, they're in a pod. But as soon as you say, like, oh, now let's go play soccer, then you're under indoor activity guidance, and you can't play soccer indoors. You'd have to go outside, and you have to do 10 people, and it would have to be physically distanced and wearing masks. So it's complicated. If you have specific questions, if you have a specific program you have questions about, please email us. We're happy to walk through the options.
I think people are just looking for, are there any childcare, options out there for kids that are too old for daycare? I think before these orders went into place, some of our local, great partners, some of our local facilities were doing some great, school day off, helping with our kids with their education, or, even though it was like maybe a soccer facility or a gymnastics facility, but now that they're limited to 10 people, those aren't even options at this point. So I think that's some of the questions that are coming out, is because of the orders, like, what are those options that are available for these kids that, they're too old for daycare?
Yeah.
So
I can tell you the thing that they're not supposed to be doing is out playing with each other in the park, which unfortunately I've seen several instances of a lot of kids out playing. So that's how we're going to continue to stay in red and have the potential to move further. So I understand, I have kids myself, so you do need to find outlets for them, but just going back to normal and letting them play with all their friends at the same time without masks and without social distancing is how we continue to spread disease.
All right, so someone has a question. Their son coaches high school hockey. The ice arena where they play is allowing 10 players and up to 4 coaches on the ice at a time. Is that in accordance with the state rules?
It is not. There are ways that it could work, but I would say that's an organized sport happening indoors and thus not allowed. There are programs where an ice rink is offering a class, like a training class, and 10 people and coaches can be on the ice in that case. But it can't be a hockey game or a hockey practice for a team.
Okay, especially if it's indoor.
Yep.
No interaction between players. So the only thing that can happen is sort of training, sort of skill building, where they're socially distant and 10 or less people.
That's what my son's doing right now. He's playing soccer outside by himself. Their team's not playing together. All right. Have we heard any news about Boulder County getting a first round of vaccines?
I have not heard anything about that.
I know that, there's definitely a lot of planning around what's going to happen. So I think the timing is still not established. I don't know that we know the actual volumes of vaccine, but it'll be targeted towards, our healthcare providers and really high risk populations for any first rounds of vaccine. For general public, I think we're still likely, spring into summer is a more likely time frame.
And then they're also figuring out, I know you read the news, like healthcare workers and long-term care facilities, they're looking at different, ways to get the vaccine out in different parts of the population. First, it may not just be a county, it might be parts of the county, first high risk and so forth. All right, so we need a clarification about the 15-minute exposure. So are you saying that if someone tests positive or believe they were test positive or believe they were exposed? I think this is two different questions, Todd. So if someone tests positive, anybody that was exposed to that person for more than 15 minutes in a period of 24 hours needs to quarantine, correct?
Yeah, if someone tests positive, yeah, they have to be, that's yeah. So close contact means within 6 feet for more than 15 minutes cumulatively throughout an entire day. So you got an 8-hour shift or a 12-hour shift, and they were around each other in a car or something like that for 15 minutes, or at a desk for 15 minutes, or even 2 minutes at a time over that time adds up to 15 minutes. That is the limit.
Now, somebody believes they were even inside or outside the business. So if you have an employee that says, I was exposed to somebody outside the business, they need to quarantine. So they might come to you and say, I was exposed to a positive case. They're going to need to quarantine.
But anybody who was in close contact with them at the business doesn't need to quarantine.
Yes.
Does that make sense?
Yeah, that's the contact of a contact. So anybody that was in contact with that person who was exposed doesn't need to quarantine. I think I'm trying to break down his question because I think there was a little confusion there. So that's that contact of a contact.
Mm-hmm, exactly.
And I use that example of my son. My son was in a class with somebody who tested positive. He had to quarantine. We quarantined him. As long as I kept him in quarantine, and separate from us, I didn't have to quarantine.
Yep.
Because I wasn't exposed to that kid in the class. So again, in a class, let's say a yoga class or a dance class, if someone says test positive in one of those classes, but they stayed 6 feet apart, and you are notified that one of your patrons in one of those classes tested positive, as long as you continue to follow the practices, you don't have to notify anybody that they need to quarantine at that point, right?
Yes, that is correct.
And then it's 15 minutes over a course of 24 hours, correct?
Within 6 feet.
Within 6 feet for 15 minutes over a course of 24 hours.
Yep.
Are we just getting some clarification?
No, this is all good.
Yep. I think we got this. All right. Someone gave me a capacity, figure outer. I took a copy of the link and we can vet it. And then if it's something that maybe I'll have it as a resource out there. So thank you, Karen.
I think that's a good idea. I saw that link. I don't know anything about it. The other way to look at it, if you're just looking for a ballpark figure, use the social distancing calculator that's available on the state's website. It'll probably be more strict than you need, but it'll give you some idea of, okay, I've got a 3,000 square foot space. There are some walls, things like that. You can do some calculations, set your capacity. It'll give you a number. It's not perfect. but really, each room in a building should have a plaque on it that says if it's accessible to the public, it should say how many people are allowed in that room.
I have a question that came in via email, and I don't want to miss it because it's a great partner retailer in town. So they had to close their break room just because they have a lot of employees. But it is starting to get cold, and they're seeking ways that their employees can find a way that they can have lunch. It was one of those situations. They're wondering if they could do 8, huts or individual spaces that are completely sealed for each person to be able to use within the break room. Putting a time limit for the employees, if that would be something that they'd be allowed to do within their break room, if there's any restrictions on doing something like that.
I don't know. I'm having trouble imagining exactly how that would work, but there's nothing in the orders that says that can't happen. I think that the hard part would be making sure that you're cleaning those spaces appropriately and that there's enough time between each use.
Yeah, really the concept is social distancing so people aren't gathering. So anything that they can do to facilitate that, like Jesse said, scheduling time so that only 1 or 2 people would be in a space and then they have the ability to be, adequately apart, especially if they're eating now, they don't have a mask on. So you're introducing risks. So the more you can manage those risks, the better it is, but it doesn't prohibit some of those things. It just would be a matter of, are you introducing something else that's now a risk? So again, the idea of an indoor hut, that sounds like a space that's probably not ventilated. So again, is that actually worse than just keeping people 12 feet apart in the same break room? So
yeah, they might have a small break room, and it's a rather large retailer that they don't have enough space for as many people that take a break at that one time. So, I think we have a lot of people trying to get creative. I've heard of, people doing the, go out to your cars and eat, but it's cold. It's getting cold. There's a lot of, people were doing outdoor lunches. So we're just I think there's people just trying to come up with some creative solutions because the break rooms at some of these retail facilities are not the biggest, and they have 1 or 2 people, it's not going to fit in there with the social distancing. So I think the question was, could we create these 8 plastic huts? Again, could you get them cleaned and make sure that there's, and make sure that they're cleaned between use kind of feeling. Just a question that was, creative question that was asked. Is there anything against it? What do they have to think about? And you raised some great things to think about. So
I see one question, sorry to disrupt the flow here, but I think it's important to note a question about the time and distance question. There was a question about, well, what about if I'm, within 25 feet of someone for an hour? The model, so the way the CDC and the state came up with the distances and the times are based on modeling of how the virus spreads. And the 6 feet for 15 minutes is basically in the modeling, it shows that that's enough time to get enough viral load to get an infection. Whereas if you're in a big room, you're separated by 25 feet, you're there for an hour, the movement of virus particles in that space is unlikely to infect you. However, it doesn't mean that you couldn't get the virus. It just means that you are not suspected of being someone who definitely got it. That's why everyone should be aware of their general health so that you can be aware. I go to the grocery store for my family. I'm the one who goes, and I have to think about the fact that I'm in there for 20 minutes grocery shopping. I'm never around anyone for very long, but it's totally possible that I could get the virus. So I need to be conscious of my symptoms all the time. And that's on all of us to really be aware of our own health so that we can protect those around us.
all right. I think the only things that have come in are comments. So any other questions? I'm gonna do a last call for questions. Just a reminder that Friday at 11 o'clock, we'll do one for landlords. of multiple tenants. You know, there's a lot of questions of like, you know, what do I do? And there's a lot of questions around offices, small offices, large offices, different types of tenants. So we will send that information out. Next week, reminder that the sessions will move to Thursdays. And then if we have any special sessions around industries or order changes or any of that, we'll keep that Friday spot open for those. We've been doing them on Fridays, so we just thought we'd keep that as a Friday spot. I don't see any more questions coming in. So thank you again, Lane and Jesse. We will see everybody. We'll see some people on Friday, but everybody else will see Thursdays at 1 o'clock, not at 3. Sorry, Todd. They're going to be at 1 o'clock. But we'll see everybody next week. And thank you for your continued questions and continued support.
Thank you.
Thanks, Corinne. Thank you, Lane.